So let's start with dimorphic fungi, dear friends. Now, when you talk about dimorphic fungi, one thing is very clear. We all know that the dimorphic fungi, they exist in two shapes. One is they exist in the form of yeast, another is mold, and we said that this happens due to different temperatures. So anyway, I'm not going to discuss about that once again. Now, you all got to remember one thing, that is these dimorphic fungi, they have septate hyphae as such. Okay, so all of these dimorphic fungi, they're going to have septate hyphae. Next, hyphae is a feature of molds, so that's not a surprise for any of us. And how are those hyphae? You have to remember septate hyphae. Fine. These diseases are more or less confined to American continent. Hence, we have said that they're endemic in American continent. But in India, the disease that we get to see, it is called by the name of histoplasmosis. Okay, it is called by the name of histoplasmosis. Fine. How exactly do humans acquire these infections and what happens after that? The transmission is by inhalational route. Okay, and this will end up causing pulmonary infections. Okay, so this would be causing pulmonary infections. Clear? Next, after this, we're going to begin with the first dimorphic fungi here. It's called histoplasmosis. So dear doctors, histoplasmosis also happens to be known by other names like Darling's disease, Cave's disease, Ohio's disease, etc., etc. So this tells us something, like Ohio is a place in North America, precisely in America, right? USA. So this means that these infections are very, very limited to certain specific areas. And that's why you got to keep an idea, like if a person is coming from that area, this infection may be expected in them. I told you all dimorphic are going to cause pulmonary infections. So there's nothing much to discuss in their clinical features except for their microscopic appearances. So right now you're seeing that this one called histoplasma, if you talk about North America, it is seen in Ohio or this Mississippi River belt. Okay. You can also see this in South America, Central America, and in India, we have already mentioned that this is one important dimorphic. Fine. Now, when you talk about the transmission of this disease, so what exactly happens is, as usual, it is coming through inhalation only. All right. So this guy comes through inhalation of aerosols. Inhalation of aerosols, and especially you got to remember it comes through bats or birds droppings. Bats or birds droppings. Fine. And as we know, the bats live in caves. Hence, if you happen to go to caves for some hiking, etc., then you may inhale this aerosols, and anytime you inhale something, more or less they go to your lungs. And that's why the clinical presentation is mostly pulmonary. So you got to remember, this is the reason this mimics TB, tuberculosis. Now, this is a thing that they love to ask, that histoplasma mainly affects, okay, histoplasma mainly affects reticulo endothelial system, you might be knowing this as macrophages. Okay, just a fancy name for this. So this organism primarily like to affect the macrophages. All right. Next, as it's a dimorphic fungus, you got to know how does it look as a mold and how does it look as a yeast. So these are the things you got to remember for sure. All right. So when you're talking about the mold appearance, okay, it has this appearance called tuberculate macroconidae. Okay, tuberculate macroconidae. Obviously, I'm going to discuss the images coming up shortly. Until then, we'll just write and keep them aside for now. Okay. Next, when you talk about the yeast form, honestly speaking, it does not have anything special, right? It simply shows the typical budding that we see, that we have talked earlier, that there is a yeast cell and there is a small bud that arises from that. So this is simply called as narrow based budding. Okay, narrow based budding, that's the name right here. And this would be seen inside the macrophages. That means these fungi with their budding would be seen inside the macrophages or reticuloendothelial system. Fine. The next dimorphic in the list is an organism by the name of blastomyces, which happen to cause a disease called blastomycosis. So the name of this fungus is simply Blastomyces dermatitidis. Since all of them are presenting with pulmonary presentation itself, that's why we are straight away jumping to the diagnostics. How do they look under the microscope? So guys, once again, the yeast and the mold forms. Now this time the yeast has a special thing. So what is special about this guy is it produces this broad-based buds. Okay, it has this appearance, what we are going to call as broad-based budding or broad-based buds, or sometimes it's even referred to as figure of 8 appearance. Okay, figure of 8 appearance. Since you already know the routine type of budding, let me just demonstrate how does this look like. So assuming this is a yeast, this will look like this. So it gives it the appearance of the 8, and you can see it's a very broad based budding. The base is very broad. So broad based budding, it ends up looking like the number 8. But what I like to do with this is, I like to remember this as the letter B because it helps you remember B for blastomyces. Okay? Are you able to understand this? So this is the typical appearance of the broad based budding, and the other one was narrow based budding in histoplasma, nothing special. So this is important. You got to know this. Clear, doctors? Next, when it comes to the mold form, there is nothing special in this. See, it's quite opposite. If you talk histoplasma, the mold is important and the yeast was not important. And here it's quite opposite. Here the bud, that means the yeast form, that is what is important. So if you notice here, how is the mold going to look like? We will simply write down here. This guy presents with septate hyphae. Once again, I told you that all of this dimorphic fungi, the mold forms will have septate hyphae. Okay, so septate hyphae with conidia. Septate hyphae with conidia. Next disease in the list is coccidiomycosis, also called as desert rheumatism or San Joaquin Valley fever. Okay. Now, first of all, as usual, we will write down the name of the organism. It is called as Coccidioides immitis. Okay, this is the name of the organism, Coccidioides immitis. What are the clinical features? Apart from the regular thing that is pulmonary infection, there is something extra that is present with this guy. And what is that extra things? Let's write down. One of the things is arthritis, and second thing that is there are some swellings or bumps which we call as erythema nodosum. Okay, erythema nodosum. See, there must be a reason why it is called as the desert rheumatism. Because it is seen in the desert areas or the states of America where desert is present. That's why it has gotten that name. Second, rheumatism. If you remember rheumatic fever, for instance, there are swellings that are found inside that topic also. And there is arthritis that you learn in rheumatic fever. Hence the name, desert rheumatism, because some features of rheumatic fever are also seen here. All right. Now, once again, the whole thing boils down to the identification of these fungi. So guys, what you are going to remember here is this: the molds and this yeast forms again. So first things, the molds here, they have a special structure which we are going to describe as barrel-shaped arthrospores or arthroconidia to be more precise. So you're going to see barrel-shaped arthroconidia. Next, the yeast form, there is a spherule, double-walled spherule filled with endospores. Okay, filled with endospores. Now, what exactly does it mean? Sir, spherule means a sphere, something round. And then you're having some spores inside it, and these spores are given a name called as endospores. Endo because they're inside, they're called as endospores. Okay, hope it is clear to everyone. The next dimorphic in our list, it is called by the name of paracoccidiomycosis, which also happens to be known as South American blastomycosis. Now let us start as usual by looking at the name of the fungus who is associated with it. See, the name is paracoccidiomycosis, hence logically speaking, the name of the organism here, it is called as Paracoccidiomyces brasiliensis. Okay, Paracoccidioides brasiliensis. So guys, you may see the word Brazil in this. That tells us something. Brazil is a country that is located in South America. So that's why the name South American blastomycosis. Next thing, diagnosis as usual. The yeast form in this, it has this appearance called pilot or captain or mariner's wheel. You all might have seen the steering that is present inside the ship, right? So that is what is described as the mariner's wheel, right? Or sometimes it has this appearance that look like Mickey Mouse. So as I told you, at the end of this dimorphic fungi, I'm going to discuss all the images one by one. So Mickey Mouse appearance, that is also seen. And the mold form in this, they have teardrop appearance. Now let's wind up this topic by discussing the last and the final dimorphic fungus, which happens to be known as penicilliosis, and its new name called Talaromyces. Okay. Now this is caused by one fungus called Penicillium, which is now called as Talaromyces. Once you learn the name of the disease, I believe it's not that difficult to remember the name of the fungi. Paracoccidioides, paracoccidiomycosis, blastomyces, blastomycosis, histoplasma, histoplasmosis, like that, Penicillium, penicilliosis. Okay, so the full name is Penicillium marnifi. Okay, This guy generally causes lesions in people who are HIV positive. Okay, or in other words, to be more precise, we can say immunocompromised patients. Immunocompromised patients. It is going to produce skin lesions. Okay, it produces skin lesions, which are in the form of bumps that are going to appear. And second, we may also expect hepatosplenomegaly. Okay, hepatosplenomegaly. Next and the last thing, that is, when you talk about the diagnostics here, we are going to see a red color pigment, a very unique thing in its culture media. It produces red color pigment, which is quite important point for the exam. And under the microscopy, we happen to see a thing which we call as brush border conidia. It is the appearance, right? It looks like brush border. So as I promised, I'm going to discuss all the images starting from now. So this image represents obviously penicillosis or tularomyces, because the red pigment is very clearly visible here. So let's look at this image now. This image will kind of, compile all of the things that we have learned about in the dimorphic, their appearances, etc. This is the reason I was not discussing them individually. Now we are going to just discuss them one by one together. Okay. See, on the left side of this picture, I've already labeled that these are the molds, and on the right side, you're seeing the yeast. All the molds have septate hyphae. Please remember that. Now, why do I call the first picture, the yeast form, as blastomyces? Because I really hope you're able to identify this broad-based budding that looks like the letter B or the number 8. So that's why this is blastomyces. In blastomyces, as I told you, what is special is this appearance. Okay, number 8 or the broad-based bud. And the mold form of blastomyces does not have anything special. So I don't think the examiner will even bother asking you that. Now, when you talk about histoplasma, it's exactly opposite. In this, the mold form is important. You're seeing this appearance which is called as tuberculate type of conidia. So that is tuberculate type of conidia. That is the feature of histoplasma. And the budding of histoplasma is just normal. There is nothing special. It looks like a normal bud that any fungus can actually produce. So that's how you're going to remember. One is narrow based budding, one is broad based. Broad is special. So that is one thing sorted. And when you talk about the mold forms, tuberculate macroconidia are tuberculate conidia are a feature of histoplasma. Done. Next, doctors, look at the coccidiomycosis. In the coccidiomycosis, I had told you it has double-walled spherule filled with endospores, which can be very clearly seen here. Okay. अब इसको याद रखना है. So what we will do is we can remember that this is your COCC coccidio. So this is the coccidio wala picture. So you need to make up this way and remember this is going to be your coccidiomycosis. And I told you that this gentleman will have this barrel-shaped arthroconidia. You can see these things, they look like, barrels. Next, if you talk about paracoccidiomycosis, they are having this appearance which looks like the wheel of the ship. Okay, so this is having that appearance, captain wheel appearance. And dear friends, they are having this teardrop appearance. So now let's make up a hint and try to remember. This is captain wheel and teardrop. You got to remember them together for paracoccidiomycosis, which is also called South American blastomycosis. So let's make this mnemonic. Imagine the captain is traveling to South America. And how is this captain traveling through ship, right? So we said it looks like the steering of the ship. So from the ship, you should derive and remember the Titanic movie, which was a very sad movie because you know what happened in the end. So let's assume that by watching the Titanic movie in the end, we all cried. That is the teardrops. So once again, reminding you, captain traveling to South America, the ship wheel, and Titanic basically made you cry. That is teardrops. Okay, I know some things may look like a stretch to us, like, sir is exaggerating this. But trust me, my friends, during examination, when you score that 1 mark, it takes your journey somewhere else. Okay, so make sure, however, whatever way you can remember these things which are tested in exams, you're all familiar with this. Last and the final, you're looking at sporothrix right now. And in sporothrix, I told you this is the guy that was rose gardener's disease, which had this mold forms having the flower shaped conidia. Rose gardener's disease, the roses, and here also there is a rose or flower like appearance. So this basically gives us a good preview of the entire dimorphic. So technically before exam, you got to revise this within a minute or so. Okay. I really hope you're able to identify this. This is the first picture, that is barrel-shaped arthroconidae, which happens to be the feature of coccidiomycosis, right? Next, you're able to see histoplasma here that has the tuberculate conidia. And this picture represents all the different types of dimorphic. I'm going to give you 1 second. If you can identify, that's great. How about this first picture? Okay, the thing I've highlighted what you need to look for, that's nothing but coccidiomycosis, because you're able to see the double-walled spherule and that is filled with all this spores. Done? Next, if you see, this is the number 8 appearance called as broad-based budding, that is blastomyces. Next and the last thing, this and this. The picture on the top, this one represents Mickey Mouse appearance. And the picture at the bottom I'm highlighting right now, this one is the captain wheel or mariner wheel appearance, a feature of paracoccidiomycosis. So with this, the discussion of dimorphic fungi is over.